Guys, welcome back to another Tuesday training for practitioners where manual and movement practitioners meet every week to talk functional alignment, structural body work, biomechanics. Hey, Gary, I'm glad you're here live with me. It's nice to have you in the house. Yeah, today we're going to talk hamstrings. Tight hamstrings is typically what we like to call them. Tight hamstrings, how it's generated from the sacrum, because it usually is 99% of the time, and also what broken tailbones have to do with this awesome topic. It's kind of a big one today, and that's okay with me because I'm here to tell you all about it. Thank you guys for being here. For those of you who are here live on YouTube, thank you for being here. Let me know that you're here so that I can chat with you. Feel free to use the chat feature if you're watching live on YouTube to communicate. Drop your questions in there. This is also your Q&A time. So I know I share every week that I'm coming in hot with the topic. I got something to share with you, and I do. And also, I want to share it with you. So please let me know if you have any questions. Use the chat feature. Let me know. Gary, of course, if you're here, you can and feel like asking questions, you can come off mute and we'll do it that way. Okay. I'm happy to have you however you're here, live and in-house or live and on YouTube. Love it. Okay, so before we dive into our content, as always, we are still playing Pin It to Win It. What do you mean by Pin It to Win It, Gina? What exactly is that? Pin It to Win It is our game that we play every week, which allows you to get more training. I'm thanking you for being here and for watching till the end. What do you pin? You pin these letters that I show up in the bottom corner of your screen each week. Throughout the whole training, there'll be letters in the bottom of your screen. You're going to pin them to the comment section below this video in YouTube. And all the letters together are going to spell a word. You're going to pin that word in the comment section below the video. And we will acknowledge your pin and we will send you an extra training completely free, just for acknowledging you for being here and committed. Gary, I feel like your camera's doing that thing again that it does sometimes. I can see your thumbnail, but I can't see you. I hope you can still hear me. And now the thumbnail's gone. All right, I'll let you sort that out. All right, so today we're going to talk tight. There you are. Hi, back again. You're muted. I can't hear you, Gary, because you're muted. Tell me again. What? Hello.
I'm using an external camera,
Oh,
and
okay.
it's got a wonky connector to the computer. If I hit that, I'm gone. I come back in, and okay.
Well, don't be gone because we want you here. So I'm
Yeah,
glad
thank
you're
you.
here. Okay, cool. Hi. And hi, I can see you guys live on YouTube. I can see that you're here. I can't see who you are, but I can see that you're here. So welcome. If you want to let me know who you are, I'll say hi to you personally. I would love to know who you are and that you're here. Okay, so Gary's going to keep track of his camera. I'm going to keep track of everybody that's live. I'm also going to keep track of the content, and you guys are going to let me know if you have questions along the way. And that's what we'll use our time for today. All right, we're going to talk about tight hamstrings, broken tailbones, why tight hamstrings are typically not the issue, and sacrum and how the sacrum is the genesis. You have a question, Gary. I feel like I could tell
Yeah,
from
when your little teaser about this session came up, you mentioned another uh, sacrum muscle, and I didn't write it down. And so, which one is
Hmm.
that one?
Well, I didn't say it yet today. You mean in the newsletter that came out?
Yeah.
Yeah, it's a
Okay.
ligament.
Mi-
You know
Middle.
this one. You know this one because you were in sacred sacrum, but it's always good to review.
Yeah.
Sacrotuberous ligament, which I will absolutely walk through that. So we do have a lot of anatomy actually to cover today, believe it or not. When we're talking about tight hamstrings and how they are not the source of the problem, even though I get it. I've had tight hamstrings before too, and I've been like, geez, someone just take this boulder out of the back of my leg. It's not the hamstring. So I'm going to walk you through how I know that and so that you can know how to know that and then also what to do about it. So that's what we're going to work through today. But I first need to start with a great story. My story of tight hamstrings. And I know for those of you who have trained with me here, you know that my usage of the phrase tight is sparingly. Right? I use it very sparingly. I also feel like it's dramatically important for us to identify what type of tightness, because not all tightness is the same and not all tightness needs the same thing from us. So if we're just recognizing that things are tight and we're using our same technique over and over again, there's a very good chance that we're actually harming the person that we're supposed to be helping. So you got to know your tightness types. That said, I was that person who had tight hamstrings, and I was positive it was tight hamstrings. I was positive it was tight hamstrings because I had injured my hamstrings in years prior, where I had dropped down spontaneously into the splits back in the day when I could do that. Just because you can do something, guys, doesn't mean you should. I learned that in that moment, dropped down into the splits because I was teaching a dance class, and voila, my hamstring was like, you are a silly girl. And I suffered with that for a while. I had a tiny little contusion. I didn't like, tear the muscle outright, but I did have a little black and blue spot, which what we know I'll know to call a contusion, which let me know that there was some damage that had been done to the fibers of that muscle. And so I hobbled around like every dancer usually does in their career. And so I was certain that 10 years later, when that same hamstring, quote, tightness came back, I was sure that it was residuals that I had not healed from that previous injury, which, by the way, guys, is not a bad way to go. Like, you definitely want to know the history of someone's musculoskeletal patterning in their body and what caused it so that you can, remember to go back and fix it fully. Sometimes what we have in today's pain is actually leftovers from yesterday's unhealed injury. And that's a big deal. Like, you really want to be able to, capture that. Sometimes it's not, but most of the time it is. And the reason is because we know about compensatory patterns and recruitment patterns. So keep that in mind. And I also made the mistake thinking that it was this old injury. But what else I had experienced since that hamstring injury was I had broken my tailbone pretty severely. It was kind of a dramatic accident. I sat down really hard and fast, all my body weight, leaning back on what I didn't think but was a piece of wood. And so I cracked my tailbone. We all heard it. It was very, very well done, very dramatic. Legs shaking and lots of pain, couldn't really feel my legs, all the things. And in my rehab of that injury, which did not have hamstring pain tied to it yet, I had gone to multiple physical therapists, multiple massage therapists, a stretch therapist, 2 chiropractors. I mean, I was yoga classes, regular yoga classes. I was really avidly working on creating a remedy for this broken tailbone, which we did have confirmation in x-rays was broken. Okay, great. And then after probably 9 months of doing all kinds of rehab for this broken bone, I seemingly spontaneously developed that hamstring tightness again. And I thought it was because I had been increasing my walking, which makes sense. I was increasing my walking. I had this injury from 10 years prior where I actually did harm my hamstring. And it took me close to another 9 months before I realized it wasn't the hamstring. It wasn't the previous injury from the hamstring. It wasn't the hamstring at all. But if you had told me at that time that my hamstring wasn't the problem, even as a body worker, I would have tried to convince you that you were wrong because my hamstring hurt that bad. So the takeaway from this story is that even those of us who are informed and educated around anatomy, and I know you all are, that's why you're here, we can still sometimes miss the source, the genesis of a problem when the symptoms are super compelling. So the remedy for that, for us to not get distracted by symptoms, is to know more anatomy. It's always to know more anatomy. So that's what I'm going to share with you today. What is the anatomy that led me to this solution to know that tight hamstrings were not tight hamstrings and that they had everything to do with my broken tailbone and my sacrum? And then I'm going to walk you through the anatomy as you gave us a highlight to, Gary. And we're going to walk through all the anatomical parts and how they all played a part together, and then you'll know what to do about it. So that's what we're gonna journey through today. You guys ready for that? I hope you're ready. I see a couple more of you came on live on YouTube. Hello, I'm so glad you're here. Let me know if you're here if you want to, and please use the chat to ask questions along the way. This is how I'm going to explain to you how tight hamstrings are not hamstrings. In fact, out of the gate, we know 90% of the pain or symptoms in the body are not where the symptoms lie, right? 90% of the time. So even though I was positive it was my hamstring and I had a very compelling story from history about why you should definitely, as my practitioner, look at my hamstrings, we still know that the law still has math that maths. It's only a 10% chance that even with my compelling history and pre-existing injury, that it would have been my hamstrings anyway. And if I had done the math, I would have known that too. I kind of did, but again, the symptoms were compelling. Really difficult to work on yourselves, guys. Really difficult to work on yourselves. But I had a lot of pain. I was healing from this tailbone. I had low back pain. I had hip discomfort, which of course just connected to my tailbone, I thought. And then I had this pre-existing hamstring thing that came up to the surface. And in my limited brain thinking at that moment, I thought, well, if I can just go back to the hamstrings and heal it from the previous injury, then the hamstrings would be out of the way. And then I could just focus on the tailbone and the low back and the hip. Sounds reasonable, right? Like, sure, Gary, totally get it. Again, if we're the provider though, and not the client, which I was, if we're the provider in that scenario, we're still going to miss it. Remember, I went to a half a dozen providers who all believed me that it was my hamstring, and I didn't get any remedy from that until I did. Okay, so we want to know the anatomy. I'm going to walk us through the anatomy and notice if when we're walking through the anatomy, if some ahas start to click for you, and I hope that they will as I share the anatomy with you, notice what that means. What that means is that the anatomy is always where the answer is, not the compelling symptom. The anatomy is always where the answer is. Where you guys come to me and say, Gina, I have a client with XYZ symptom. What do I do about it? The way we get to that answer together is always in the anatomy. What's the anatomy that's involved? What's that anatomy supposed to be doing? What's it currently doing? And what does it need from me? Not the symptom, but the anatomy. The answer is always in the anatomy. So in order for us to solve complicated cases or even compelling cases that aren't that complicated, but just compelling to distract us, we always want to know the anatomy. What is the anatomy? I also want to highlight it's the anatomy, not the technique. Here's what I mean by that. We have a lot of techniques. Even in my training, I teach lots of technique to do this, do that, do this, do that. And every time I teach one of those, I say, you guys, this technique is not a treatment plan. Whatever the technique is that we know, and I highly recommend that you guys be very skilled in lots of techniques because lots of them are great, and each individual body needs a potpourri of their own formula of techniques. But even when we're steeped in techniques, the technique is not the answer. I just said that. Not every technique works for everybody. Otherwise, it would be the technique that is the answer. It's not the technique. You do need to have techniques though, but the technique is not the answer, which is where a lot of us miss finding the genesis. We'll take this technique off the shelf and use it on this body and see if it worked. And then it kind of did, it kind of didn't, or it didn't at all. And we take this technique off the shelf and we add it to the body and we see how the body likes that technique. And it does or it doesn't work. Sometimes we get lucky, but not often enough for us to believe that that's the solution. Techniques are not the solution. The technique is what you use for the anatomy when you know what the anatomy needs. That is the solution, not the technique. So I'm a real cheerleader for us to know more anatomy and know more anatomy and know the function of the anatomy, not just the parts, but how they work together. And so I know you guys are too, and that's why you're here. So, hey, Val, I'm glad you're here live. Nice to have you here. So I want us to also be thoughtful about, it's not the technique that we're going for here. It's the anatomy and what it went through in this injury. And that will then allow you to pluck the right technique out of your technique shelf and add that to the treatment that you're working on. Okay. So we're going to go over somewhat briefly, but with enough detail for you to have some handle on it. We're going to go over conus medullaris. We're going to go over sacrum, coccyx, sacrotuberous ligament, and hamstrings. Now, if you were just like, what the freak did she just say? Got it. This is part of the reason why I believe a lot of us sort of sidestep the anatomy, because the language is all Latin. It's spoken in a language that we don't currently speak. We feel like we're not involved in the conversation. It can feel a little daunting, and I totally get that. My intention here today is to break it down for us so that it is approachable, okay? So conus medullaris, it's 2 words, spelled C-O-N-U-S, second word M-E-D-U-L-L-A-R-I-S, conus medullaris. Sacrum, which I know you guys know because sacrum is the sacred bone, and that's what we're focused on this month. The coccyx, C-O-C-C-Y-X, which is the tailbone. Sacrotuberous ligament, which is the ligament being the second word, sacrotuberous, spell it phonetically, sacrotuberous ligament, and then hamstrings. We're going to go over all of those today. I'm going to show you how everything before we got to hamstrings is why a tight hamstring is not a tight hamstring. At least it's not the place that we want to work. Okay. And by the way, all of this anatomy, which is, I think, so critical for us to know, all of this anatomy is deeply covered in our Sacred Sacrum course because it often is the sacrum as the genesis. So the Sacred Sacrum course is what's happening right now in our club. It's happening through the month of February. You have free and open access to this entire course for the whole month. And we go over all of this anatomy and then we workshop out the anatomy as well in that course. So please do feel free to join us there for, as my guest. You can come for a week and just dive in. So, and without any obligation, you don't have to stay, you just come and dive in and grab all of that. And so if this anatomy was already like, oh my God, there's no way I'm going to get all this in one Tuesday training, well, then come get it in the course and you have access to that as my guest for free for the rest of February. But let me give you a little bit of it now. So Conus medullaris is, Gary, do you remember Conus medullaris? Do you want to be hot seated right now? Heck no. Okay, so it was in Sacred Sacrum. And I love this, by the way, because Gary, you were diligent. You showed up for every lesson in that course. And I loved having you there. I still love having you there. And this is so helpful for all of us to learn together. This is not a judgment. This is not a criticism. Even when we show up 100% and we are diligent, we take excellent notes, which you do, Gary, and you show up every freaking week on Tuesday training as well. We still need to review, my friends. We still need to review. We still need to review. Sometimes I still need to review too. I'm like, wait a minute, I know what that is, but I can't remember this one piece of that part. You guys, we need to know the anatomy. In order for us to solve these issues, we need to know the anatomy and we got to review it. So if you're thinking like, oh, I took that course and it didn't help me. Did you review the course? Did you go back and review the details? Did you review your notes? Did you apply your notes and what you learned in the workshopping of that course in your clinical setting and then come back and look at your notes and put the pieces together? If you didn't do that, then you're blaming the wrong entity. You're pointing at the course or blaming the teacher, and that's just not true because that's not how we learn. Do you have something to add, Gary? Yeah, go ahead.
Quote your 20%.
You want to do it? You do
No,
it.
you do it.
No, you do it. Okay. So because we're using our anatomy to learn anatomy, we all get to remember that the way the brain takes in information and how the synapses fire and things land with mirror neurons and other lovely firework displays of neurology going on in our brain, even when we're paying attention 100%, as we just got to share with Gary, 100% student attention wise, and every other way too, we can still, in our 100% effort of attention, still only retain 20% of what was shared. It's just the nature of communication too. So think about that even in conversation with another person. You think you told your spouse what the grocery list was, but they only heard the first two things if you gave them 10. If you gave them 5 items, they only remembered 1. So it's a 20% game on memorization and retention. And that's for all things, not just anatomy, but especially anatomy. So give yourselves a chance, right? Give the course a chance, give the teacher a chance, give yourselves and give your clients a chance by reviewing. There's several practitioners who've graduated my training program, who've taken Sacred Sacrum multiple times and are still gleaning more information from it. And it's just so valuable to do that. And also, guys, I did the same thing. I didn't like put my hand on a book and memorize all the words from, index to index. I had to review things over years. It's one of the values of being at something for a long, long time, but only if you've spent that time reviewing. If you spent that time being confused, you've just memorized being confused. But if you spent the time, whatever time you've spent, repeating and reviewing, then you retained more. So you get to choose how you spend your time when you're learning. I highly recommend reviewing. So again, that's one of the reasons why we offer a full course every month inside our club. So you could have a chance to review it and then study together. All right, let's get back to the anatomy. Not our usage of anatomy, but the anatomy that we need for this particular common complaint of tight hamstrings. First off, conus medullaris. Thank you for letting us take this segue, Gary, with you. Conus medullaris is part of the spinal cord, comes from the brain all the way down the spinal cord, is housed inside the vertebra. And it is an important piece for us to know from a structural perspective, because where that conus medullaris stops and starts is right around L1, L2, which is in this beautiful juxtaposition of spinal curves, spinal segment curves, thoracic and lumbar, which go in two different directions. It's the juxtaposition of concave and convex, but it also stabilizes, it tethers itself down to the tailbone. So it stabilizes the spinal cord at L1, L2, all the way down to the tailbone, which now we know the spinal cord. This is what I want you to do with this information. Not only is the spinal cord attached to the tailbone, which is why I had so much pain when I broke my tailbone, but also it requires the alignment of the thoracic cavity, the alignment of the lumbar cavity, the alignment of the sacrum, and the alignment of the tailbone for it to be happy and healthy. How do we know this? Because it's part of the spinal cord, which we would put in the category of nerves and nerve endings, which are very strategically placed in the body with assured clear distance. You've heard me say this about nerves before. They would make terrible New Yorkers. They don't like their space infringed upon. They don't like sharing their space. They don't like being bumped out of their space. They want their space. They want only their space, and they don't want anyone infringing on their space. So if there's a misalignment that's happening at this area of the thoracic or upper lumbar, or anywhere else down the pike to the tailbone, conus medullaris and the spinal cord bundle that comes from it would be affected in not assured clear distance of space, because when the body is in the alignment that it was designed in, there is no pain. So right away, we know that there's a nerve involvement when it comes to a tailbone break and all the way up to the thoracic cavity, lower thoracic cavity. This is important to know because remember I said I had a broken tailbone, but I kept thinking it was a previous hamstring injury from the splits. No. Follow the anatomy and it would have told me, this is actually from the tailbone. This isn't from the previous hamstring injury. Although compelling to go there, I get it. But if you know the anatomy, at least it would give you pause. I don't know. Is it the previous hamstring injury, or could it be something going on with the spinal cord as it relates to its tethering on the tailbone? It's got to at least be both. I got to at least contemplate both if I'm going to solve the problem for my client. I can't just ignore one or not know one and then go to the hamstring and just dig away and try to release that hamstring. Go ahead, Gary.
Yeah, your other symptoms, lower back pain, even lower thoracic issues are other clues to the fact that this isn't just in this one location. That nerve is affecting all those areas all the way down.
Agreed. Yeah.
And
Go
it
ahead.
sounds like you had all those symptoms.
I didn't have lower thoracic discomfort. I had lumbar discomfort. I had hip discomfort.
Mm-hmm.
And I had SI joint, obviously, some, cranky SI joints, also pretty common in my body. But then I also had this hamstring pain, which we don't tie hamstrings to thoracic and lumbar alignment nearly enough. And we absolutely have to. You guys, if I could make the world of bodywork easier for you, I would tell you to memorize these 4 curves and memorize these 4 curves and return them and return them and return them to those 4 curves by way of all the anatomy that's involved in them. I'm telling you, if there was ever a technique, it's that. That's not a technique. That's a knowledge of functional anatomy, but you got to know the functional anatomy so that you know what technique to throw at it. I knew a million things to do for tight hamstrings. None of them worked. So did the handful of practitioners that I went to. They also knew things for hamstrings. None of them worked. None of them. Okay. And this is not a dig on practitioners. This is an invitation to be inspired by the anatomy, because the answer was in the anatomy. The answer was not in a technique. And I've said this already. I'm just going to keep repeating it till we land that plane, because we got to repeat things before we can memorize them, as we said already. Okay. Then, of course, the sacrum. Right? We've been talking about the sacrum all month. The sacrum is the keystone of the entire structure of the body, all the way up and all the way down. We've talked about that last week and weeks before. Please go back and get that, or come take the entire course as my guest for a week inside the club, because you really want to know everything that this sacrum is involved with and responsible for if you're here to resolve musculoskeletal and orthopedic issues. You've got to know the nature of the sacrum, because it's literally the hub on the wheel. I can't express it any more than that. So if the tailbone, which is the bone just below the sacrum with a movable joint in between it, that's what broke. The bone itself didn't break. It was when you break a tailbone, most of the time it's that you like dislocate that joint between the sacrum and the coccyx, which means that all the connective tissue on the sacrum that the tailbone also shares to be held in place. And we know there's connective tissue holding it in place because it's a movable joint. If there wasn't anything holding it in place, it would be a floating bone in the body. It would be a dangling participle somewhere. It's not. It's held in place with a movable juncture in between it. Right there, because we know our anatomy principles, that should click. Joints are where the action happens, which means there's muscles involved and there's connective tissue holding those bones together. We know this from our training on the 8 functional anatomy principles, which I laid out for you all last month and the month before. So again, we're going to use our anatomy to help us with this information. Broken tailbone, you might never have met a broken tailbone before. You might not even know what it is. But if you know that it's a bone that's adjacent to another bone, and you know anatomy, just the principles of anatomy, you can piece all of this information about, well, what would the impact of a broken tailbone be based on the anatomy? It no longer becomes just a siloed injury, like, oh, well, only if you have broken tailbones is it this, and only if you have tight hamstrings is it that, and only if you do something to this part of the body is it that. No. The body's design is the body's design, and there's principles of anatomy that we can use on all design of the body. And an injury is only where one of those design parts is now in duress. Great. Use the anatomy to get you back to the answer then. I'm telling you, it's the easiest way. Hi, Lana. I'm glad you're here. Hola. Glad that you're here live with us too. Okay. So now I've shared with you about the sacrum and the coccyx, or the tailbone. And now I want to share with you another beautiful anatomical part, which is sacrotuberous ligament. Again, spell it phonetically. Sacro, S-A-C-R-O, tuberous, T-U-B-E-R-U-S, sacrotuberous ligament. Okay, now you might not have heard that I thought it was a phrase when I first heard it, to be honest with you, but it's just a name of a body part. If you've never heard that before until now, here's how you can use the anatomy to support you in getting to the answer. Sacro sounds like what part of the body? Sacrum. Bingo. Oh my gosh. So now we're like, aha, whatever this part is, whatever this phrase is, whatever this thing is I'm about to learn, it has something to do with the sacrum, which I know is really, really, really important, because I know that the sacrum is the keystone of the entire structure of the body. So if there's a part that is related to, connected to, or nearby the sacrum, I better pay attention, because now what I hear when I hear sacro anything is I hear structural imbalance. Aha. Okay, well, now I don't even need to think about hamstrings. Now I'm on structure. Muscles, like hamstrings, a tight hamstring, will only be upset if the bones that they connect to and the connective tissue that are connecting them are in duress. Muscles don't spontaneously get upset. They get upset when things are out of alignment, or when you're asking them to do a job they shouldn't do. So I still don't want to blame the hamstring. I want to go to the structure. And now I know that sacral tuberous ligament, even if I'm only hearing about it for the first time, is probably something I need to focus on. I've almost swallowed my own tongue. I'm getting very excited. Okay, so sacrotuberous, the other part of the word. When you hear tuberous, what does that sound like to you? Sacrotuberous. What's the tuberous part? Resonate? Anything? Any other body part? Tuberous? You're welcome, Lana. Anybody in the chat here? Sacrotuberous? I swallowed my tongue and then 3 people jumped off. Don't be afraid. I won't drown on TV or on camera. Not TV, on camera, YouTube TV. Okay, tuberous, tubers, ischial tuberosity, tuberosities, right? Sacral tuberous ligament. So now we know that the tubers on the ischium, on the ox coxa, the ischial tuberosity are also involved in sacral tuberous ligament. In fact, a ligament we know does what? What's the job of a ligament in the body? It's the job of a ligament. You know this one, Gary. What's the job of a ligament? What does the connective tissue ligament do in the body? What's its role?
The stabilizer?
Nope, close.
Oh,
It does stabilize, but by connecting bones. So ligaments connect bones in the body.
bones.
Yep.
Yeah.
So ligaments connect bones. And in this instance, the sacrotuberous ligament connects the sacrum to the tuber, or the ischial tuberosity, sacral tuberous ligament. So it connects these two bones together. Now, if you guys have not yet had a look at the ligaments in the pelvic area, specifically relative to the sacrum and the innominants and how they are connected together, I recommend you go Google that. We have lots of imagery in the course, of course, because we're sharing this visual part of it. But if you don't have that visual part of it and you haven't yet joined Sacred Sacrum, definitely Google the ligaments of the pelvis, and you will see this intricate, beautiful piece of art that is all the ligaments that hold these three bones together, and in the basket weave formation that they create to allow movement and dexterity and all kinds of complicated connections to happen in this area of the body. It's absolutely beautiful. But we're only going to focus on one, and that's the sacral tuberous ligament. And the reason why I want us to focus on this one is because not only does it connect the sacrum to the ischial tuberosity, but it also traverses the top of the coccyx, right? Which is the tailbone that we talked about. Tailbone and sacrum are connected together, not connected, but they create a joint where they both meet. And what connects two bones together is ligament. We've already said that. So the ligament, sacrotuberous ligament, has a relationship between stabilizing the sacrum to the tuber, and it also has a relationship between connecting the sacrum to the coccyx. There's other ligaments that do that too, but this one definitely is involved in all three of those. Because of where it lives and its broad band, it's kind of got like a long, thin band, then it gets a little bit broader and then more like my finger down here at the bottom. But it also has a connection here to the SI joint, and it's partly responsible for the stabilization in the SI joint. And remember, I said with all of my symptoms that we were trying to parse out, I said SI joint, and it's also really common for me. So remember that at the beginning of my own self-diagnosis, tough to do, I was like, it's got to be a previous hamstring pull, and it's got to be this common SI joint discomfort that I have. So I'm going to disregard the SI joint discomfort, and I'm going to focus solely on the hamstring because of this previous injury. But instead, if I had focused on the structure, the answer would have revealed itself, because this ligament has something to do with all of those, with every single one of them. This ligament and Conus medullaris has everything to do with every single symptom I had. Now, why does sacral tuberous ligament have something to do with hamstring pain? Anybody know? Gary, does this ringing a bell now? How does sacral tuberous ligament directly correlate to hamstring tightness?
Well, it would put that ilium out of alignment. If they were not balanced, then you would have a higher hip joint on one side than the other.
Okay, well yeah, I like that
That's a
idea for sure. If one of the dominants is askew from the sacrum and higher, then this ligament down here you could see would be affected by that for sure. In fact, it would be affected by any of the movements of these bones that we're talking about for sure. In this particular injury, though, it wasn't a hip injury, so it didn't affect the innominate directly, although indirectly, of course, we've just said it has to be indirectly because they're all connected. But this broken tailbone right here created the hamstring pain. How? Is anybody here in the chat? You guys piecing this together yet? Is the anatomy clicking together where it's Let me ask it this way. Is the anatomy clicking together where you're starting to be suspicious that something else caused the hamstring pain instead of it just being a tight hamstring? Anybody? Valerie, Lana, I know there's a couple others of you here too. I just don't know any names. Anybody want to guess? Okay, I will give you some intel. Notice where we said the sacral tuberous ligament lives. It does traverse the top of the coccyx, as we said. It does have some information here to help stabilize the SI joint. It doesn't do that all on its own, but it helps out. Remember I said, please get a visual in your mind so that you can see these beautiful ligaments and how they're all, it's like perfectly orchestrated. It's like the best work of art you've ever seen. But if I just parse down just to this ligament, sacral tuberous, this ligament connects this bone from here to this bone right here. What other anatomical parts, let's use our anatomy, what other anatomical parts live here? Nerves connected, Lana, guess? Which nerves, Lana? Which other anatomical part connects here? Anybody? Which anatomical part does the ischial tuberosity holler out to you? Like, oh, I know who lives there. Who lives here? What anatomical parts live here? Rhonda. Hey, Rhonda, I'm glad you're here. Are hamstrings also attached to the ischial tuberosity? Yes, they do. Yes, they do. So we have several hamstring attachments here. The one that's the most medial, they're really close together, but the one that is the most medial is semitendinosus, and it almost directly attaches at the same place where the sacral tuberous ligament attaches, almost directly. So there's going to be a relationship there between that ligament and the muscles that attach on that same bone. And that ligament is unhappy because one of the bones that it attaches to was displaced. So just as we said with your example, Gary, if the innominate, if there's a high innominate on one side, for example, the ligament would be affected. It would absolutely be dramatically affected if this joint that it was responsible for holding together was now dislocated, right? Broken tailbone. You could see in my x-rays, that this little coccyx was just a little bit hunched, like a little hunkered over there to the left. I'm not proud of it, but I think it was cute because I was like, wow, look at you, little guy. You're way out of place. So if this bone here was displaced into this direction, the ligament that holds these two bones together was under dramatic distress, which means that the other end of its attachment is also under distress. Remember, similar to muscles, both attachment points matter. Different to muscles, not a lot of blood flow. They're not changeable. They don't like to be wrenched and moved. So the wrenching on this end of the ligament created a lot of distress on this end of the ligament. It was a bad deal. And with a tailbone break like that, the sacrum is also no longer in alignment. Now, why? Because these two bones are meant to live together and all of those ligaments are meant to hold them together. So when this one got wrenched, this one got affected. The bone here was more noticeably affected because he was over on the left in the x-rays, but we know that the sacrum was also affected because the joint between it was dislocated, and we know that that same ligament also stabilizes this joint here, and that ligament was under duress. So I had SI joint pain and I had hamstring pain, not a whole lot of tailbone pain at this point of the game. Remember, we're like a year and a half after the injury. And because the tailbone was still dislocated or broken and hanging out over onto the left, the conus medullaris from my spinal cord that tethers to the tailbone was also under duress. And that's why I had so much low back pain as well. Hey, Perry, glad you're here. I would look at the lumbar region. Yes, exactly. I was going there next too. Beautiful. I love that you pieced it together. So all the hamstring pains down here, all the practitioners wanted to focus down here. I just gave us anatomy that should be compelling enough to have you say, there's a lot of other really important parts there that I don't really want to spend too much time stripping the hamstring or stretching the hamstring. Oh my God, please don't do that. And as I started to share with us about conus medullaris, it requires a perfect juxtaposition between the concave and convex curves of thoracic and lumbar, and then a balanced lumbar curve, which would have been challenged when the tailbone and sacrum were impacted, because that's also another juxtaposition. And we know the thoracic was impacted because thoracic and sacrum balance each other. So that's how we solve this mystery between what happened that created so much distraction in hamstring tightness that had nothing to do with hamstring tightness, all from a broken tailbone. Okay, and I want to add one more thing in here, especially because you brought up the lumbar region, Perry, and I'm so glad that you did. Even if your client doesn't have a broken tailbone, and my heavens, I hope that you don't have clients with broken tailbones, because that is an injury that just took so long to heal. I'm not upset about it though, because look at all that I got to learn for all of us. So, and I appreciate every injury I've ever had. I'm sure you guys do as well. When you have an injury, learn from it. I mean, be a patient first, like be patient and be a patient. Let another qualified provider help you. Don't get wrapped up in your own symptoms, because you'll squirrel just like I did. And then learn from it, follow the anatomy, and let the anatomy give you a lesson. Because your anatomy and your physical experience with that anatomy is teaching you something that I can't even teach you. I can't give you an experience inside your body. Only you and your body can do that. Your notes can't do that. I can't do that. I can give you information that you take good notes on, but experiencing it in your own body, that's where it's at, for sure. So let yourself heal and then learn from the anatomy. And here's what I'll say about hamstring tightness and the lumbar area. Oftentimes, when practitioners recognize that hamstrings are tight, even if they want to assess their client, they'll have their client go into hip flexion. And if the client can't touch their toes, they're like, oh, see, hamstrings are tight. Hamstrings won't lengthen to let my client touch their toes. And the clients got their hands on their hamstrings and they're going, it's so tight here. It's so tight here. Okay, let's use our anatomy one more time. When we go into hip flexion, the action is not stretching the hamstrings. The action is in the contraction of the opposite muscles, the agonist muscles that do that joint action of hip flexion. The action is always contraction. We know this from our anatomy principles that I outlined for you last month. I wrote that book on 8 principles of anatomy because I kept coming back to it over and over and over again for myself. And every time I'm walking you guys through how to problem solve something for a client, I refer back to these principles. So make sure you have those 8 principles, like really have those for yourself. You'll always refer back to them. So if I'm going to touch my toes and I'm going to blame my tight hamstrings for not allowing me to get there, that's only partly true. Because when we know the lever system and we know what joint action is, in order for me to have length in these muscles, I must have strength on the other side of the lever. If you're like, I don't know what the freak you're talking about, Gina, please go back and look at a previous Tuesday training on lever system and hip flexion. We've done a lot of them, and it's really worth it to really get your head around that. So part of the way the lever system works, the initial way, is in the action, which is contraction. And the antagonist must allow that to happen. So again, practitioners who do know about action is contraction and it's hip flexion done by psoas and rectus femoris, and its hamstrings aren't allowing it because the hamstrings are tight, Gina. I already assessed it. All right, hang tight here for a second. Why would the hamstrings be tight though? Sometimes it's because we just don't exercise this lever, and that would be the simplest, easiest solution. But when you have a client over and over and over and over again that you keep treating tight hamstrings and they're still tight, if you're one of those practitioners who says, oh, I know your hamstrings are always so tight, let's make sure we start our session releasing your hamstrings. What you've missed is the message from the body that the anatomy is trying to give you some intel. Because once you release them and the lever system is restored, there's no reason for them to get tight again. Unless there is a reason for them to get tight again, and then it's the reason that you want to go look at, not the tightness that you want to keep addressing and releasing. So that's the way you problem solve through that. One of the greatest ways that we can create, quote, tightness in hamstrings is by the position of the bone that they attach to. The origin of the hamstrings, we've said, is ischial tuberosities. We just talked about that when we talked about sacral tuberous ligament. And I would also recommend, if you guys are still learning your muscles, go back and learn them, learn how they move and what they do. It'll help you. Hamstrings attach here. We know that all muscles on a lever can only be fully capable of the alignment of the bones that they're attached to. Even when you have released a hamstring and strengthened a psoas, you still can only get maximum use out of them if the bones that they attach to are also aligned. That's why we do so much structural alignment in the SHOTS method, because we're working to restore muscle action, but we can't do that unless we're aligning bones. And I don't mean skeletal, high velocity chiropractic adjustments. Don't come at me. I'm not doing anything illegal. We do have our own mode of how to do that. That's what the whole method is about. And because I know this method inside and out, and I know the anatomy and the balanced lever system, and we have master classes on that as well, I know that if a muscle's not working, I don't want to just blame the muscle, because muscles don't just spontaneously get upset. That's one of the things that manual therapists have been ill-trained to think. I was one of them. I get it, guys. But then I was like, it's not working over and over again. I keep working on the same thing. You guys have heard me say that Groundhog's Day. Well, then I started looking at, how does the muscle move? What does it need to be able to move that way? And then I started finding the problem. So hamstrings originating here at the ischial tuberosity absolutely require that the pelvis be in alignment, for sure. But one of the greatest ways that the innominants in the pelvis are not in alignment is due to what's happening at the lumbar spine. So one of the greatest ways I can catch 90% of the people in the room is, if your lumbar spine right now is touching the chair that you're sitting on, your lumbar curve is reversed, your sacrum is tucked under, your innominants are now in a different position, and that is pulling on the origin of your hamstrings. We can blame tight hamstrings all we want, but if we don't fix the lumbar spine and its alignment, well done, Gary, I'm glad you're adjusting, you're sitting. If we don't adjust the neutrality of the lumbar curve and the neutrality of the bones in the pelvis, we can go after, quote, tight hamstrings for all of our days, and our clients will be grateful that we did a lot of concentrated work, and eventually they will grow tired of that because the pain will have not gone away. It will only have subsided a little bit, if at all. Chances are you might have irritated the tissue and made it worse. And when your client doesn't come back or they stop working out with you, it's because we didn't actually solve it at the source, which is always those 4 balance curves. Okay, guys. That's what I have for you on the anatomy. I'm so glad that we took the journey together. Was that a helpful review for you, Gary? Yes. Okay, good. Oh, and there goes his camera again. All right. Well, while we're waiting for Gary to come back, I just want to make sure that I emphasize one more time, all of the information I just shared with you today and the workshopping that goes with it is available through the end of the month, through the end of February in our club. You are more than welcome to come with no obligation to stay. You could just come for a week as my guest. We'll meet you over in the club. You'll have full access to the entire Sacred Sacrum course, all the anatomy that we just talked about, plus the workshopping that goes with that course, and also live study groups each week in the club, so you can work this all out in community, a very strong community of practitioners who've taken the course more than twice, each of them. And they also workshop this out with their clients, so you can talk shop with them. And I'm also in there live every day, workshopping it out with you guys, taking you to the next place, asking you the next question, also giving you the next answer. You know, I like to ask a question before I give an answer, but you won't leave without an answer. You'll just be challenged to really get that information in your being, because we're not here to just memorize data points. We're here to think through the anatomy. So we spend a lot of time focusing on that in the club. And I want to make sure that you know about that so that you have access to this course and everything that goes with it, because then at the beginning of March, we're bringing in a different course. So please make sure that you join us in the club before the end of February if you want access to the Sacred Sacrum course. Awesome, Val. I don't know what you're saying yes to. Maybe it's the reviewing of the Sacred Sacrum. And also, if you are one of our previous Sacred Sacrum course attendees, you know that there's new information in this course that we have in the club right now. We just went live with it last fall. All new information, Conus Medullaris, and all the other deeper neurological tissues we added into the course this time. So it's just really a great thorough course, and I'm proud of it, and I love what it can do for you. One of the things that we heard from the live attendees was that it was dramatically changing the way they worked with their clients, like from week one. And we just really love that. That's the whole point, not to just flood you with information, but also change how you work and the results that you create. That's what I want for you. That's why I show up here every week. So that course is really a good one. And once we take it out of the club, it's not available for free anymore. So please do enjoy that while you have access to it. Okay, over to you guys. Questions, Gary. Another question. Go ahead.
What, if anything, did you do to realign your coccyx?
Oh my goodness, it's such a good question. It's a little extensive. I worked a lot on all the muscles that are attached to the sacrum. It's funny that you bring this up. It's one of the reasons I love this course, because I feel like I broke my tailbone to be able to teach this course as well as, with as much information as we covered in it, for sure. There's so much soft tissue that's related to the sacrum and the tailbone. And the actual joint itself can only be adjusted. Get this, guys. The actual joint, the coccyx and the sacrum, can only be adjusted at this point from the inside. And I was like, yeah, I'm not on board for that. So I got to do a lot of work to try to really affect these bones and the muscles that attach them and all the ligaments as well. I spent a tremendous amount of time realigning these bones. Again, that's what we do in the SHOTS method, and then strengthening all the muscles that go with it, and then balancing out the lever system on both sides, and then keeping those four curves as balanced as possible. And some of you guys know this, I'm hypermobile. So it's really a feat for me to keep anything staying. So again, I feel like I had this injury so that I could come back and share it with you guys. Like, guys, it's possible. You can get them out of pain. And here's all the anatomy that's involved in that. Silly me thinking it was just a tight hamstring. So it was pretty extensive, Gary, and it took quite some time. It would take me less time now that I know what I know, but that's true for all of us. Once you know more anatomy and you understand the function of that anatomy, and then you've practiced it in workshopping it out with your clients or even on your own body, you'll get to the next one quicker. So in the meantime, when I've had clients come to me with broken tailbones, have that look in their face, like I recognize that look, like, oh God, this is how it ends, like I'm always going to be this way. It's kind of like what happens with this particular injury. I can speak for myself and with the clients I've served. It feels like that feeling that happens when you get a diagnosis, like it's permanent because it's so extensive. But I promise you it's not. I promise you it's not. And I'm really grateful that I can be on the other side now and say that and say to my clients, this is not how the story ends. We're going to get you out of pain. And
Eric Dalton, God rest his soul.
yeah,
I
love Eric.
know he had some techniques for working ligaments in that lower sacrum area.
Mhm.
Did you try any of that, know any of that, or did any
Yeah.
of that work?
Yeah, absolutely. It has to be done in order because, again, just
Right.
like we said at the beginning of our time today, the technique is not the magic bullet. The technique that you choose has to match with the anatomy that you're addressing and what that anatomy needs. And the only way you can know that is by knowing the anatomy, not by knowing the technique.
Right.
Can't emphasize that enough. I have stacks of certificates of techniques. None of them made any sense until you know the anatomy that goes with it. However, that said, yes, I also I train my practitioners in Sacrotuberous work. You can do that manually if you're a manual practitioner. I also have ways to teach that if you're not a manual practitioner where the client can do it themselves. Because you definitely need to stay in your lane. If you're not a manual practitioner, don't go probing around on people because that's breaking the law. Don't do that. So yes, I did release ligaments. I did stabilize pelvic floor. I did stabilize all the muscles on the outside of the sacrum as well as on the anterior side of the sacrum, balanced all the bones in the pelvis, and then repeat, 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 repeat until it all just came back together. You know what I never had to do? I never had to stretch my hamstrings. And yet the hamstring pain went away. So there you have it. All right, guys, anybody else here live who has questions? We have just another minute left. Please type it in and I'll answer those questions for you. I want to thank you all so much for being here today. Did you get value from being here today? Guys in the live chat, did you get value from being here today? Did you learn something that you didn't know coming in? I hope. What to do about it? Yeah, the what to do about it is the next step, right? Like what to do about it. Oh, good, Val, I'm glad. Good, good. Then what to do about it is the next step. If you're still looking on what to do about it as your first step, you're probably not going to really like me because that's not how you do it. Otherwise, you're just a puppet and you're just sort of repeating things, over and over again and not knowing the effect that they're going to have. So you do need to have techniques, but you want to know the anatomy first. Okay, Gary, awesome. So you're going to actually post that in the YouTube channel in the comments under the video. So right now you and I are in Zoom. You're going to go over to the YouTube channel and do it. You could also get to this video, the YouTube video in the club. You're a member of the club. Just go in and look for live Tuesday trainings and you'll see the videos there. Okay. And you can type that in there. Awesome. I'm glad you're playing. Pin it to win it. Oh, good, Lana. I'm glad that you found good value here. Val, good. I'm glad. I'm so glad. All right, great. I'm glad that you guys found good value. That makes it purposeful for me to show up every week. I love pouring into you guys. I love that you're here to gather all this good, juicy information. If you think that there's a colleague of yours nearby who could also benefit from the information, I'd super appreciate you liking the video and sharing it with them so that they know where to come and find the information. Whether they can come live or watch it on the replay would be great. Be sure to check out the Sacred Sacrum course while it's available for you through the club. You can come be my guest for a week and not have any obligation to stay or pay. Just want you to have the information and then we'll move on to a new topic for next month. Next week though, same time, same channel here, we're going to do one more walkthrough on Sacrum. So I look forward to seeing you guys then. Have a great week. Continue to do awesome work in the world. I'll see you guys next time. Bye for now.